Hi, I'm Scott with Great Lakes Seminars, and I am here to show you the MFR Leg Pull. We show this in the comprehensive knee class and find great success with it. We use this technique when we have a suspected fascial restriction somewhere in the lower extremity. It's more of a shotgun technique, meaning that it's not specific to any one part of the leg. It really is more something's going on. We can use this as an assessment as well as a treatment. The fascia can get bound down kind of like these shorts in all kinds of different areas. And logistically, you don't have the time to find every single one of those restrictions. So what we're going to do with this is either pull them into internal rotation or external rotation via the fascia to smooth everything out. Okay, this feels great. It's a patient-friendly technique. I will use it a lot of the times to gain trust with patients if I've already done something that was less comfortable for them, or at the end of a day, again, if they've are just exhausted from whatever PT we've already done, it's a nice kind of wrap-up technique. Okay, so. For this, if we are going to go into internal rotation, there's nothing to say you can't go do both. You can go internal and then you can go external. I'm going to show you both. There's nothing to say you can't do one or the other. It's kind of your choice, whatever your clinical reasoning guides you to. But if we're going to go into internal rotation, we're typically going to release this entire fascial line, this direction, up to the IT band and down. And then on the medial side, if we're going into external rotation, we're going to release everything up into the groin here. So if I'm going to go into internal rotation, I would want my inside leg back, my inside hand on the dorsum of the foot, and my other hand goes at the calcaneus. And then from here, we're going to just start dropping my inside shoulder as we're getting a little bit of fascial pull right through here. When the tissue pulls back at you, that's where you're going to stop. And you're just going to wait. With the fascial system, it really does take 2, 3, sometimes even 4 minutes for a fascial restriction to release. So you're going to camp here for a little bit. So get yourself comfortable. This is a situation where you really do want the patient to kind of rest, have them diaphragmatically breathe, have them not be telling you, all about the traffic or something else that stresses them out, because we want their system to kind of downgrade or wind down. Once you feel a release there, then you can have you can take up the next barrier, excuse me, and that usually takes you up to the peroneal muscles and into the IT band. Once that releases, then you can rotate a little bit further. Now, sometimes you'll feel a little bit of torsion over here at the medial aspect of the knee, so you will have to bring the knee out into abduction. And then I'm all the way up at the greater trochanter. Okay, and then I'll slowly come out of it. So that was very, very quick. But each one of those points may last for 3 or 4 minutes, and there may be 5 or 6 of them all the way up. If we're going into external rotation, pretty much the same concept, only now my outside hand is going to be on the dorsum of the foot. My inside hand goes on the dorsum, or on the calcaneus, and then my outside leg is back. And really the concept there is just to allow my hips to rotate when I do that. Then from here, we're going to go into external rotation. I feel a little bit of a barrier right here. I'm going to hang out right there, right around the posterior tibialis region, a little bit of the gastroc. Once that releases, then I'm going to go into kind of pes Rhine region and the medial knee. Once that releases, we go a little bit further into external rotation to the adductors. and all the way up into the groin. And then when you're done, you just slowly come out of it. I hope that helps. It's a great technique for patients that you're trying to just clean up the system. You're not sure what other thing you can treat. That is a great technique for that situation. Hope you have a great day.